This segment is sponsored by MEDARVA at Stony Point Surgery Center.
PACKids is a group of children's doctors and healthcare professionals working to build an independent children's hospital right here in Richmond. The hospital will have a specially trained staff to cater to the unique needs of children and their families, and would be the first of its kind in our area. I'm here with PACKids board member and mother, Dr. Melissa Nelson, and president and CEO of the MEDARVA Healthcare, Bruce Kupper. It's nice to see both of you. Thanks for coming in this morning.
Thank you.
This is an interesting conversation to have. Tell me a little bit, let's start at the top, about PACKids, would you?
So PACKids is an organization that was formed over the last 18 months by a group of pediatricians and then expanded to include pediatric specialists in order to move forward the vision of a freestanding children's hospital for Richmond, Virginia, and for the surrounding area. There's been a lot of discussions over the years about a children's hospital for Richmond, but we thought with the physicians coming together in a unified voice to really explain the needs of our patients, maybe we could finally make this vision a reality.
And to alleviate some confusion, we do have an entity in town called Children's Hospital. This is a different entity, and how is it different?
Well, in Richmond, we're very lucky because we have excellent pediatric specialists, pediatric physicians. We have excellent allied healthcare professionals dedicated to pediatrics. Unfortunately, in Richmond, we have those specialists all over town. And so parents who have children with special needs know quite well that to get complete comprehensive care, you have to navigate the system that we have and travel from hospital to hospital and office to office in order to get comprehensive and complete care. The facility that we're talking about would be the one place that a parent would know to bring their child for all of those services under one roof. And it would include not just that complicated child, but also a child who's having an asthma exacerbation and is having trouble breathing, a child who broke their arm and needs it to be seen by a pediatric orthopedist. So what we have in Richmond is good, but we believe we can offer much better by bringing together all of the services we have into one location.
I understand. Thank you for that explanation. That makes sense. And Bruce, with MEDARVA Healthcare, you are part of a team that has some of these different specialties that fall under that umbrella, but yet you've embraced this idea. Why is that?
Well, to answer your first part, yes, we probably provide more outpatient care, surgical care to children than any other facility in Central Virginia. We probably do more pediatric urology procedures than any other facility in the state. But even that said, we believe that this is a conversation that needs to take place. We believe the community needs to get involved with it. The three systems have been having a conversation, the physicians have been having a conversation, so MEDARVA feels that the community now needs to become involved in the conversation, and that's why we're stepping up to the plate and providing funding for that effort.
And you've stepped quite up to the plate. You've made a $25,000 contribution to get this plan continuing to roll. And what kind of an impact does that make?
It's a tremendous impact, and just as Bruce said, it's been an issue that's been on the table for Richmond, Virginia for years now, and we believe that if the physicians can unify their voice and the community can unify its voice and really speak to the leaders and join forces to state that we really need and deserve this type of facility for our children. It's the kind of facility that exists in almost every other city across our country. And Richmond children deserve no less than every other city our size. So we're hoping that together the community along with the physicians will be the secret sauce to get Richmond to move forward on this project and build a freestanding hospital for our children.
Well, it's fantastic that those voices are already coming together and that conversation is being engaged. Thank you very much, you two, for coming in. I appreciate it.
Thank you.
You can learn more about pediatricians associated to Care for Kids or PACKids, their efforts for a new children's hospital. Go online to packkids.org.